It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. Up first on today's show, we're going to hear about venous insufficiency from vein specialist Dr. Peter Morgan.
Debbie presented with severe swelling and large bulging veins in her legs, one leg much worse than the other. She had coexistent, severe, very advanced osteoarthritis in her knees, so she really had some big problems with both of her legs.
Every morning and every night I would measure my ankles and just below my knees. I would have a difference of sometimes as much as 1.75 inches between morning and evening. And when I saw Dr. Morgan, he discussed the options with me. And then, as I said, having double knee replacements, and 3 doctors whom I highly respected all said, get it done before you have your knee replacement because it will do so much in aiding the healing.
Before having her knee surgery, she came in to us to have her veins treated. We did ablations on her legs. Her swelling improved, her varicose veins improved substantially, and her legs felt much better, and she ultimately went on and had knee replacement.
I don't go to bed at night with my legs aching. I don't go to bed at night just sometimes almost in tears if I've had a real active day because my legs were so swollen and ankles were so swollen, and it made a huge difference for me.
The patients that I dreaded seeing previously in my practice, now I enjoy seeing them because I know that almost all of them have been seen and treated by numerous other physicians unsuccessfully, and I know that I can treat them successfully, not only for their wounds, but if they have swelling, pain, bulging veins, heavy, tired legs, all of those things can be successfully treated.
About a month ago, my great niece was over and wanted to ride bikes, and we ended up riding 4 miles that day. I could not have done that previous to not having the vein surgery because it's made a big difference in my level of activity.
To avoid your child being poisoned, be sure to store all medicines and household products up, away, and out of sight in a cabinet out of their reach. Poison Control reported 9 out of 10 poisonings in children occur in your home.
I came to see Dr. Varughese on the advice of my primary care physician because my blood pressure was a little elevated and my EKG reading was a little off. She suggested that I take a stress test and have some other procedures done just to determine the causes of that. And it was determined that I did have blockage in one of my arteries and a stent had to be implanted. And then reality sunk, and Dr. Varughese talked to me during the recovery time, and I asked her in tears, I asked her what was going on. I asked her, was I about to have a heart attack? And she said, yes.
Yolanda Garcia, to this day, she's so thankful that her primary care was cognizant enough to send her for evaluation, because many times primary doctors or nurse practitioners who see all of these patients, they may not recognize because the patient's not complaining much. So I think this is a wake-up call for all of us as physicians and healthcare providers to really focus on prevention, evaluating the patient early, getting them to the right specialist on time.
Because of her, I'm able to take care of my clients. Because of her, I have a better life. So I really am appreciative of all she has done for me.
Well, coronary disease in women especially is it's the #1 killer of women in this country, and pretty soon will be the #1 killer of women all over the world. And in Hispanic women especially, there's a high prevalence of diabetes. So therefore diabetes lends towards cardiovascular disease and coronary disease especially. It's just so important to educate our Hispanic population, our Indian population, because Indians die 4 times the rate of any other population from diabetes and cardiovascular disease. People are hungry for knowledge. It's just for the lack of knowledge we perish.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market. For those of you who may be suffering and are not aware of what GERD is, we're going to find out and see how Zachary's life was completely changed after he was treated by general surgeon Dr. Cliff Thomas.
I'm studying music education and I'm studying opera. I have voice lessons twice a week. I have choir rehearsals every day. I have opera rehearsals all the time. And so I have to be in tip-top shape. And before this surgery, if I sang for more than 30 minutes, I was done.
So some people wonder what GERD is. What's going on is the esophagus is tube that goes from the back of the tongue down to the stomach. And at the bottom of the esophagus where it connects the stomach, there's a one-way valve that should let food and juice into your stomach but not let it back up into the esophagus. When it goes back up into the esophagus, it can burn the esophagus and then cause the symptoms like heartburn and coughing, asthma, a lot of symptoms.
Acid reflux all day, every day. I mean, I would eat, acid reflux. I would not eat, acid reflux. Have a drink of water, and so it was one of those things. I would wake up in the morning with a sore throat. It would affect my singing, like I said.
So I've been doing surgery laparoscopically for 22 years for reflux and have excellent results. And what we do is an outpatient procedure. Through very small incisions, we go in there and we reduce the hiatal hernia. So that's basically where there's a little gap in the diaphragm and the stomach's protruding up into the chest. So we pull that down and close that gap in the diaphragm and rebuild that one-way valve. The operation takes less than an hour. People usually go home an hour after surgery. They're usually doing everything within a week. And they're usually getting out of the house in 1 to 2 days after surgery.
Actually, I told Dr. Thomas the results of this have been amazing. The very, very first morning after my surgery, I woke up and I almost started crying, literally, because it was the first time in my entire life that I had woken up without a sore throat. One
of the more common things people tell me after surgery is this is one of the best things they've ever done in their entire life. So this heartburn symptoms kind of is in the background of their daily life, and it may not seem like the worst part of any one day, but when it goes away, their quality of life improves so much and they don't have to live with it, they're kind of ecstatic.
It's been an amazing, amazing improvement in my entire life, and it's something that I'm so, so grateful to have had done.
Your thyroid gland is an important organ. It's right here, right in front of your windpipe. Now, many people can be low on thyroid. That's hypothyroidism. That's the most common type of thyroid disorder. And there's also hyperthyroidism, an overactive thyroid. That's less common. The hypothyroidism is more common in women, but it does affect men, and it can cause symptoms such as weight gain, fatigue, thick skin, coarse hair, constipation, all kinds of things, all of them involved in slowing down of your bodily functions. Now, if that's the case, you go to your doctor's office, they draw what's called a TSH, thyroid stimulating hormone. That will be low, and then the physician can start you on a medication that will improve your thyroid hormone level in your body. Your metabolism will come back to normal, your weight may go down, your skin and hair changes will get better, and your energy level will respond. Now, if you're hyperthyroid, overactive, that can be a problem with heart problems. It can cause atrial fibrillation, which is a rhythm disturbance. It can cause excessive anxiety, as well as high pulse rate and trembling. So if you have any of those symptoms, get your TSH checked by your physician.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
I weighed 236 pounds. It was just time. I needed to do something to feel better, healthier. I needed to feel healthier. I needed more energy. I needed to do something. I had the lat band as opposed to the sleeve or gastric bypass because it was less invasive and it was really the right decision for me personally.
She's increased her exercise in response to having the control to lose the weight more easily, so there's a positive reinforcement there. If they do the right thing in terms of exercise, if they're consistent, then they see a bigger drop-off than they had seen before they had the surgery.
As time went on, I started dropping the weight, eating, slowly, liquids and then your soft foods, the way that you were told to do it. And things it started to work out for me. I started exercising more and eventually it just started falling off.
Right now she's running, she's trained for a half marathon. And those are great things in terms of the exercise side of taking care of the weight. When it comes to eating, it sounds like she's doing a fairly good job switching to things that are lower calorie, less animal fat, and lower glycemic index. But it sounds like something, occasionally she eats things that aren't ideal for her. But I think her exercise takes care of that, and that's why she's at ideal body weight right now.
Physically, to be able to not huff and puff going up and down a flight of stairs, mentally, to work, to educate yourself, I think it makes it easier to feel confident about yourself. It makes things that much easier. Before the surgery, I was 236 pounds, and 3 years later, I am down 85 pounds.
Unfortunately, with a lap band, it's difficult to tell sometimes ahead of time who's going to do well and who's not going to do well. And we have patients that do very well with it, and that's great. The problem is the predictability when it comes to the lap band. So she's an example of someone who's used it as a tool the way it's supposed to be used. Unfortunately, that isn't the case with everybody.
For more information and to check out hundreds of videos on all of the amazing doctors that you see on today's show, just head to our website. It's bestdocsnetwork.com. Now up next, we're going to see how Minnie's life was changed after having her bunions treated by podiatrist Dr. Gabriel Maislos.
Minnie presented in my office complaining of a painful bunion deformity. A bunion deformity is that deviation of the great toe where you see that bump on the side or bump on the top. It has to do with a deviation of the first metatarsal, and basically, it just became really painful for her to walk in her regular shoes.
Yes, because I really had this bunion, I think probably about a year. And so it had got so bad I couldn't even wear a shoe, so that's what really made me came in, to have surgery on it.
The next step was for us to take an x-ray and to evaluate her foot and determine what kind of surgery would be appropriate. So after looking at an intermetatarsal angle, we basically decided that an Austin bunionectomy would be the best procedure. And so that's what we ended up doing.
After I had the surgery, I felt much better, no pain, it just felt better. And I was so happy, to get it done.
I mean, as long as you address the underlying etiology, the cause of it, then you're not going to get a recurrence, and it's wonderful. I mean, people suffer from painful bunions all the time. It can be painful to the point that you can actually develop an ulcer at the side bump because first it gets red, and next thing you know, you have a wound. And that can be problematic because then you can get an infection to the bone.
I mean, it's not sore or nothing. It just feels better. And so he really do a good job, and he makes me feel comfortable. I mean, he's a real good doctor.
Bunion surgery has a bad knock to it. A lot of people are concerned that They've heard from their neighbor, or they know someone at work who's had the surgery and it's extremely painful. I have some patients that have zero pain from the bunion surgery, but I can keep the area numb for 3 days with a pain pump, which is a device that just gives continuous drip of local anesthetic and it keeps it nice and numb. Because really, inflammation is the first part of wound healing, and that's in the first 72 hours, so the first 3 days. It's a great relief for patients. Really, 2 weeks of just not putting weight on it, and we've really come a long way with our surgeries.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment. Betty has a question for Dr. Peter Morgan. Will my venous insufficiency worsen without treatment?
Patients with chronic venous insufficiency that are untreated will always get worse over time. Patients that have a strong genetic predisposition for it will get worse faster than patients that have simple lifestyle issues.
University General Hospital is a hospital like no other, with state-of-the-art medical treatments in an inviting environment that pampers patients and families and encourages relaxation and healing.
Hip revisions happen for several reasons. The one was they just came loose, and they can come loose just because they were never put in correctly, or sometimes they just come loose. And the second reason is infection. About 2.5% of the hips put in nationwide get infected, and once they're infected, they have to come out and you have to start over. Occasionally, I see, like this patient we did recently, had been infected for several years. I'd already revised her other hip that was infected, but she's in bad health, and she was in a nursing home for many years, and had not walked until we revised the first hip. She had not walked in 2 years, and then after revising the first one, she actually got out of bed and was able to ambulate her in the house and for short distances. But the second hip, which had been chronically infected, eventually put her back in the bed and was bedridden. And so we just replaced hers recently. And in this case, her femur was broken in several places. The infection was really bad. I mean, just a very complex 7-hour surgery. But it looks good. 20 years ago, the mortality rate from a hip fracture was around 40% of the people died within the first year. And currently that number is around 10 to 15%. And the difference is fixing it, replacing it more often than trying to fix it, replace it with a new hip, and get out of bed and get back, just get back to activity as soon as we can. I think that hip replacements, for the most part, have just been one of the few miracles of modern science. I mean, you take somebody who's either has arthritis or a broken hip that literally cannot function in life, the pain is so severe, and then do a typical normal hip replacement is an hour surgery. And you can have a hip that's absolutely normal. In fact, 95% of the hips get so good that people forget they had one. And it becomes a normal hip, and they can go on with their life and do everything in the life that they want to do, with extremely few restrictions once they're healed up. I really love what I do, but what I love most is trying to take somebody whose life is really just totally destroyed because of what's wrong with them, because of pain or disability, and trying to get their life back. And that encompasses much more than just the surgery. And that's what I enjoy. It's getting someone's life back.
The Best Docs Network is all about doctors helping change people's lives. It's educational, informative, and real. Log on to bestdocsnetwork.com.
On our website, bestdocsnetwork.com, all of our doctors have profile pages with bios, videos, and much more. Be sure to log on and check them out. Now, up next, we're going to hear how Karen's life was completely changed after having breast augmentation from plastic surgeon Dr. David Altamira.
You know, I just always felt like my body was out of proportion. When I would try on clothes, it was never when I looked into the mirror what I envisioned in my own mind. So I guess that's what prompted me to start researching and looking online. I never felt like my full potential.
Karen came in just wanting to have bigger breasts because she'd always felt that her breast size was out of proportion. to her hips. She'd always wanted to be a little bigger. She just felt she needed it to kind of balance out her shape. So she was, after discussing it with her, a really good candidate for that.
As soon as I met his staff and him, I know he had that attention to detail. Just speaking to him, something about him set him apart from the others. He just made me feel safe. I knew I could trust him and his work.
So there's a lot of factors that go into it. By taking the measurements and using them carefully to that particular patient and matching it to the size of the implant, we can give them a good, aesthetically pleasing size and shape that looks good and matches their body.
It was an outpatient procedure, so I came in that morning. The same day I was out and back at home. It was a really good experience.
It really made a huge difference in her confidence and self-esteem. It may seem like a small thing to just someone who didn't know her or just a casual observer, but in her mind it made a world of difference. It just really changed her personality. She kind of brought her out of her shell. She just felt better in a bathing suit, in photographs, just being out socially. So it was really a real blessing for her overall.
Before my breast augmentation, I was wearing a size A, and after the augmentation, I was a C. I had already decided I wanted a very natural look, and that's something that's very important to me. That is what Dr. Altamira gave me, a very natural look, and I'm very happy with the results.
BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs.
Welcome. Today we're here with Dr. David Fish, who's the Director of Interventional Cardiology at the Texas Heart Institute. Dr. Fish, thank you so much for joining us today.
It's my pleasure.
So we know that you have done so many wonderful things in your career. Today we have just a few minutes to talk about one of your great interests is transcatheter aortic valve replacement. Could you tell the feeling about this?
Well, we're fortunate here to have had over the years very highly qualified, very gifted students of medicine and doctors who come for their postgraduate training in cardiology here. And among these, a number selected choose to go into interventional cardiology. That is, of course, the branch of cardiology involved with putting instruments in the body and opening arteries and correcting structural defects in the heart. It's been my great privilege to have trained a great many of the operators who have gone out from the Texas Heart Institute into the community and to other places in the country, and brought forth the skills they've learned over there.
I know that you have been my favorite teacher in all of my career, and I thank you in front of the world for being such a fabulous teacher about cardiology and about life.
You're very kind.
Thank you. We just have a few more moments. What would you like to tell the public about the Texas Heart Institute and perhaps getting their evaluations done here?
Well, the Texas Heart Institute has a long tradition of research, patient care, and of course teaching. And in this kind of environment, I think patients get the best possible care and the most astute kind of understanding of their problems and their specific needs. In addition, of course, with the critical mass achieved here with all of the different researchers and the different clinical efforts and the different programs, every patient has a chance to get the very best of what cardiology has to offer.
Well, we thank you so much. You've been such a tremendous force here in the Texas Heart Institute and in my life, and I want to thank you.
Thank you.
My symptoms were like I would always wake up in the middle of the night having short breath, and then on the baseball field, like I'd be the one bending over all the time. I was the only kid on the team that would always be slouched over trying to grasp for a breath. And I would say that was my major symptom right there, my major problem.
Aaron is a young athletic teen whose mom brought him to see me because he was never been able to breathe through his nose. He feels tired all the time, and he complains that he doesn't have enough oxygen. He feels like he's short of breath.
I've been to several different doctors around Houston, and they've always thought it was asthma or something else, but Dr. Nguyen has taken his time to actually look into my nose and go further into seeing what was wrong with me.
When I examined Aaron, I noticed that he has a severe deviated nasal septum combined with enlarged turbinate. The turbinate are the swelling part on the side wall of the nose, which contribute to more than 75% of his nasal obstruction. We discussed those findings with his mom and him and decided upon a plan of treatment that consists first of correcting his septum and using energy radiofrequency coblation to reduce the swelling on the side wall of his nose, therefore increasing his nasal passage and increasing his oxygen intake.
2 months out of my surgery, I feel like I can breathe a lot better. It feels like my performance in baseball has improved. It feels like I'm getting a really good night's rest every night. It just seems really amazing to finally get that breath of air that I've always needed.
Aaron's surgery was performed in an outpatient surgery center. The procedure took around 45 minutes, and Aaron goes home the same day.
Dr. Nguyen has forever changed my life. From when I was born to now, I could not breathe, and now I can. We just appreciate what Dr. Nguyen has done for my life.
Those were some really life-changing stories today, and that's going to wrap up this edition of Best Docs Network, the show that features some of the best doctors in the Houston area that really make a difference in people's lives. For more information and to check out all of our videos, head to our website. It's bestdocsnetwork.com. And if you have a question, comment, or a life-changing story of your own, we love hearing from you. Just send us an email at info@bestdocsnetwork.com. Thanks for watching, and I'll see you next week.